Hello everyone, welcome to my channel. Today we have another pediatrics question for step 2. If you would like to see more step 2 questions, please like and subscribe. A 7-year-old girl is brought to the emergency department after collapsing during a game of tag at school. Witnesses report that she suddenly lost consciousness while running but woke up in a minute without confusion. There were no abnormal shaking movements, tongue biting, or loss of bladder control. She meets all developmental milestones and takes no daily medications. Her father reports that an older sibling died unexpectedly while participating in a competitive soccer event as a teenager. On examination, her blood pressure is 104/66, pulse is 82, and the remainder of her physical examination is normal. Serum electrocyte levels are within normal limits, and electro diagram is shown below. Which of the following medications is the most appropriate long-term treatment for this patient? First things first, we need to come up with a diagnosis. The patient is 7 years old and she lost consciousness, but there were no abnormal shaking movements, tongue biting, or loss of bladder control, and she lost her consciousness while she was playing a game. And looking at her blood pressure, pulse, and physical examination, everything is normal. When I look at her EKG, we can see a prolonged QT interval here, which is concerning and interesting given that her sibling also died while playing competitive soccer, and all these combined make me think that she might have congenital QT, prolonged QT interval syndrome. And with that being said, let's go over the answer choices, which, by the way, this condition can leads to syncope and also sudden death while playing sports or games or similar activities. Quinidine is not the best medication because quinidine is also a class 1 antiarrhythmics, and we don't use them for this condition because it can make LQTS, which is the name of this condition, even worse. B. Ibutylide. We also don't use it for this condition because it's actually a class 3 antiarrhythmics, and class 3 antiarrhythmics, similar to class 1 antiarrhythmics, can make this condition even worse. C. Propranolol. Propranolol actually can be used because propranolol is a non-competitive beta blocker, non-selective beta blocker, and this is actually a good choice for this condition. D. Levetiracetam, and this is not the best medication because we use this for generalized seizures, and generalized seizures usually come with jerking movements, tongue biting, as well as urinary incontinence, and that's not what we are seeing here. E. Efosoximide. Efosoximide is used for absence seizure, and with absence seizure, patients don't completely lose control over their body, which is the case here. And sotalol is the last answer choice. Sotalol is also a class 3 antiarrhythmics, and we don't use them for this condition. With that being said, the correct answer choice is C. Thank you very much for watching this video, and don't forget to like and subscribe. Thank you.